Welcome to Plaid for Women TV, your go-to resource for the business of life. Whether the CEO of your home or your own business, women struggle with the same challenges. At Plaid TV, we discuss real-life issues affecting real women and offer solutions to help you achieve your goals, get connected, and be heard. Together, we will change the world. Let's do this. No mean girls allowed.
Hey, welcome everybody to Plaid for Women Television. I'm Siobhan Palmer. In this series, we're talking about women and health, specifically mental health. I want to welcome back my guest, Dr. Nekesha Oliphant. She's the Associate Professor of Psychiatry and Behavioral Health at the University of North Texas Health Science Center in Fort Worth, Texas. Dr. Oliphant, welcome back.
Thank you.
This has been a great series, and in this segment, we're going to be talking about past and current treatments, which are of great interest to our audience, obviously family members and those suffering from mental illness. So let's start in past treatments of the mentally ill, maybe even go far back as the 50s and 60s. It was not a good time back then for treatments, was it?
It was not. The only medication we had at that time was Thorazine, and that's considered a first-generation antipsychotic. First generation meaning these were the first treatments we had.
Out of the gate.
And these medications caused a lot of side effects and often portrayed in movies and very negative connotations of those on treatments being very sedated, shuffling gait, drooling. There's a very negative portrayal, but these are very real symptoms that can occur if the medications are not adjusted appropriately.
And that, movies like One Flew Over the Cuckoo's Nest or A Beautiful Mind, where people would almost become catatonic, some of the side effects, like you said, the affect and everything. So it's no surprise that many people did not want to take many of these medications.
Absolutely. And there's the fine line between, is the presentation of catatonia due to the mental disorder itself, or is it a result of the medication and the medication side effect?
Right.
But either way, it was not very appealing.
Another big side effect I understand would be tremendous weight gain. Is that true?
Yes.
Okay.
Definitely weight gain is one of the concerns. It's something that we're more focused on now with the second generation antipsychotics, which have less of the side effects of shuffling gait and drooling. It actually works also not only on the positive symptoms, which we consider the hallucinations or delusions, but they also work on kind of the negative symptoms, meaning the flat affect or the poverty of speech, not really able to carry on conversations, and also any mood component that's added to that. But the side effect is weight gain, metabolic syndrome, which encompasses diabetes and cholesterol. These are all things that have to be monitored.
No, absolutely. The cost-benefit analysis.
Absolutely.
Another form of treatment I understand is called ECT. Would you explain what that is? That can be very effective for treatment-resistant depression.
Yes. It can also be used in schizophrenia in some instances.
Oh, I did not. Oh, that's interesting.
It is, and it's a very medical procedure now. Again, thinking of movies like One Flew Over the Cuckoo's Nest, where it's almost a torture treatment. That's definitely not the case.
That's not the case at all.
These days, it's very well monitored. Individuals are sedated or under anesthesia as they would be for an outpatient procedure.
Sure.
There's a sterile environment, monitoring vital signs. Basically, the most that you see with the treatment is maybe a twitch of a toe or twitch of a finger.
Like a Frankenstein-like portrayal.
Right.
And what does the ECT? This is electricity that's placed strategically in the patient's brain?
Yes, it's either on one side or on both sides of the brain, depending on which areas of the brain are being targeted. And it's similar to what you would see in a seizure if you were to monitor an EEG of the brain waves. And it basically interrupts the pathway and the signals that are perpetuating the cycle of the mood disruption or the thought disorder.
So ECT for depression. We've got some new generation medications out there. But let's talk about the whole person. Many people are looking at more holistic type ways to treat themselves, body, mind, and spirit. I know you've got a double degree, and part of your degree was in music and art education. How have you incorporated that talent and that passion into your work with the mentally ill?
Well, thank you for asking. It's, to me, very important that individuals understand, and these are practitioners as well as patients, the mind and the head are connected to the rest of the body.
Absolutely.
And one cannot be treated fully without caring for the other. So the approach to treatment is dealing with all aspects, mood and thought, as well as family support, as well as social support, as well as spirituality, every area. So incorporating music for me is one of my passions. Having worked as a music therapist, I'm actually in a state hospital setting before, using music as a way of coping, relieving stress, developing skills of maybe guided imagery or deep breathing, a way of controlling your own symptoms without thinking the pill is the only answer. Not having a culture that believes that I have to take a pill to treat everything.
Right.
So that's part of one treatment approach. Meditation is another approach that some people will take.
Be very effective.
Sleep hygiene, so not taking a pill to go to sleep and another one to wake up. Just making some minor alterations to help reset your circadian rhythm.
Right. And circadian rhythm would be?
That would be how our body's clock.
Ah, okay.
And it wakes up with the light and it goes to sleep when it's dark.
Right. Well, Dr. Oliphant, this was a fascinating series talking about mental illness, causes, and the treatments. You know, as a practitioner, what would you like to leave? I'd like you to leave us with a quote or a personal experience that you've had over these years treating this population with mental illness.
I would have to say one of the most important things that I try to tell everyone is mental health and mental illness is a disease process just like any other disease process. There are treatments, support is required, but there also has to be a message of hope.
Absolutely.
And by instilling that message of hope, it helps others have the courage to continue the journey.
And reach out for the help they need.
Absolutely.
Doctor, thank you so much. It's been very fascinating.
Thank you.
Ladies and gentlemen, this is Siobhan Palmer with Plaid for Women Television. Thank you for joining us on this series on mental health. We'll see you next time.
Thanks for watching Plaid TV. See you next time.